am Meghna Goswami, lecturer of Manibabula Nursing College, Pukat Rasaria University. Today I am going to demonstrate procedure of NG tube insertion and feeding.
So, what is nasogastric tube? Nasogastric tube is a long, thin, flexible tube inserted through nose and down into the stomach or small intestine. A nasogastric tube or NG tube is a special tube that carries food and medicine to the stomach through the nose. It can be used for all feedings or for giving a person extra calories. The size and type of NG tube will depend on need of the patient, include lavage, aspiration, enteral therapy or stomach decompression. What is NG tube intubation? So, nasogastric intubation is a medical procedure involving the insertion of plastic tube through the nose, throat and down into the stomach. Orogastric intubation is a similar process involving the insertion of plastic tube through the mouth. Nasogastric tube come in various sizes that may be 8 French, 10 French, 12 French, 14 French, 16 French and 18 French. Types of nasogastric tube. Two types, Levin tube and sump tube. Levin tube is a single lumen holes near tips and it is a most common type of nasogastric tube. It prevents accumulation of intestinal liquids and gas during and following surgery. Prevents nausea, vomiting and distension due to reduced peristaltic action. It has radiopaque line. It is used for the final placement of NG tube. Second, sump tube. It is also called as a Salem tube. It has double lumen and radiopaque line. First lumen used for the suction of gastric content. Second lumen for the blue extension open to room air to maintain a continuous flow of atmospheric air into the stomach. Control the amount of suction pressure placed on stomach wall. Prevents injury and ulcer. Selection of nasogastric tube. Select the feeding tubes based on the tube's composition, intended use, estimated length of time required, cost effectiveness and tube features. Soft, flexible, small diameter tube that is 8 to 12 French is recommended for nasogastric feeding. Use polyurethane or silicone tubes for anticipate long-term feeding. Polyvinyl chloride PVC tube should be used for a short period of time, usually for gastric drainage, decompression, lavage or diagnostic procedure. PVC feeding tubes have adequate efficiency and are most cost effective. Purpose of NG tube insertion. To feed fluid when oral intake is not possible, to dilute and remove consumed poison, to instill ice-cold solution to control gastric bleeding, to prevent stress on operated site by decompressing, to relieve vomiting and distension, to collect gastric juice for diagnostic purposes, to administer medicine and feeds as part of management of an obstruction. Indication: gastric gavage, clients who are unable to maintain adequate oral intake to meet metabolic demands, surgical cases, ventilated patients, neuromuscular impairment, intestinal obstruction, and gastric lavage. Contraindications: nasal fracture, face bone fracture, oral surgery, cancer of esophagus, larynx and pharynx, esophageal varices, base of skull fracture, recent esophageal or gastric surgery. Scientific principles. There are total 7 principles. Principle of anatomy and physiology, microbiology, psychology, physics, chemistry, economy and safety and security. Principle of anatomy and physiology. So, anatomy principle, that is the route of insertion of NG tube, that is from the anatomical structure from the nose to the stomach. So when we are inserting the tube, the route of the NG tube, that is it will be start from the nose, it go to pharynx, then esophagus and stomach. The physiology, so physiology, that is when we are inserting NG tube, patient having no taste and it not stimulate hunger, so sometimes indigestion will occur. So here when we are giving NG tube feeding to the patient, we have to explain the patient which type of food we are giving to the patient, so it stimulate the hunger and the normal physiology of the GI system will be occur. Second principle, principle of microbiology. It is a clean procedure. All articles should be clean. Wear the clean gloves for the prevention of cross infection and less exposure to body fluids. NG tube is in sterile package, so during the time of insertion only, package should be open, and after it immediately we have to insert NG tube for the prevention of infection and contamination. Third principle, principle of psychology. So we have to explain the procedure to the patient if patient is conscious, and if patient is unconscious, so we have to explain the procedure to